Hi, so we are going to be talking about PCOS, which stands for Polycystic Ovarian Syndrome. So, what this means is that cysts, which are fluid-filled sacs, are growing on your ovaries, and it would look something like this. So, many of you know, uterus, mind the drawing, this is an ovary. And what this can mean as far as symptoms, it could mean no menstrual cycle to a light menstrual cycle. It could mean problems with conception due to the last symptom. Weight gain, abdominal pain, fatigue. Could mean excess hair and mood swings due to increased testosterone and decreased estrogen. You could also have a risk of type 2 diabetes or increased risk of heart disease later on in the diagnosis. So when one of these rupture, so let's say this one goes, there will be fluid on the uterus. And they can usually find this with an intravaginal ultrasound or a regular ultrasound, but they will usually do an intravaginal ultrasound so they can see it better. And whenever they see this, they either know that you are about to start your menstrual cycle or that one of these bad boys ruptured. So the rupture can cause lots of abdominal pain, so bad that some people that come into the ER for these ruptures, they might not know that they have PCOS, but they come in with this extreme pain, and it's so bad that the doctors give them morphine. But these ruptures can cause lacerations on the ovaries and of the uterus, causing internal bleeding, the belly to protrude due to swelling, and it can cause the ovary to twist, losing blood supply, losing function of the ovary if not treated quickly enough. So the growing can also cause this twisting and losing blood supply to that ovary. The cause of this condition is unknown, so there's no real way to know a treatment either. Diagnostic testing requires irregular periods, excess androgen, or polycystic ovaries for a diagnosis, or one of the two. And usually the way that they'll figure this out is a series of multiple tests, which consists of a pelvic exam, intravaginal ultrasound or regular ultrasound, or blood work to be done to check levels of FSH, which is follicle stimulating hormone, levels of progesterone, testosterone, or prolactin, because these will usually be increased due to the irregular functioning of the ovaries and the uterus. Like I said earlier, there was no treatment, but doctors will usually recommend birth control pills, which I do not personally recommend, because on personal accounts that I've heard, these are hit or miss on treating the symptoms anyways, but for the people that it did work on, it was short term, or it made it harder to conceive once the pill was no longer taken. And another way that you can suppress the symptoms is your diet at home, and that is to avoid irritants. So you'd be eating non-irritants like avocados, white meat, salmon like fish, vegetables. You would drink water or pulpless juice to avoid irritating this diagnosis that you have. But something that can be considered an irritant is like greasy foods, acidic foods, spicy foods, dairy or caffeine, which is a lot of what we like at this age, considering it is childbearing years that this condition is brought upon. And my prognosis is that people find ways of coping with this, but they do not exactly find a cure, like I said before. People go to therapy for these new burdens that are on their body and mind. Some outgrow PCOS once they get out of their childbearing years, or in some miracles, some outgrow it while they're in their childbearing years. Some have claimed that they have found ways to shrink existing growth, or they have stopped new growth, but I don't know if this is factual. I haven't heard numbers to consider it factual. Just figured I'd throw it in there. And obviously another treatment would be a hysterectomy, but considering this diagnosis is brought on in childbearing years, not a lot of people want to do this, but it would get rid of your pain. You would just no longer be able to have children. So that is not exactly ideal. But thank you for listening to this morbid topic.